Hello, everyone. Welcome. I welcome you all on this evening where we are talking with our esteemed members. A little introduction about me. I am Dr. Maida Hussain. I am a medical doctor from Pakistan, and I'm the vice president of Positive Plus Foundation. Today we have with us esteemed members, Dr. Hussain Al-Amin, who is the president of Positive Plus Foundation and who's been contributing a lot to the community in terms of public health and other community engagement programs. Along with him, we have our member Felton. Felton is a brilliant guy. Felton is from Liberia. He's the founder of an esteemed organization called INNOMBEL, which is an African organization also engaged in community engagement programs in Liberia. So I welcome you both in our program today, and we'll be discussing what these brilliant people are doing there in their communities. Thank you for being here. First of all, I would like to have Dr. Hussain Al-Amin, who is the president of Positive Plus Foundation, tell our members today and everybody else who has joined for this session that what is Positive Plus Foundation about and what is this positivity in him that is he wants to spread all around the world. Over to you, Hussain.
Thank you so much, Dr. Maida. So I basically provide a very simple 3 example. In everyday life, we are all right now in the negativity, right? Everything is in a negativity. If you go for Facebook, if you go for in the Twitter, go for the YouTube, everybody wanted to spread negativity because negativity has a very good business, right? When there is a negativity, people will go there. People will want to make sure that like some negativity, and I wanted to give some kind of impact or something like that. But the problem is, if we would like to spread the positivity, so that will be the great. But it's a very simple text, very simple things. But unfortunately, people are unable to do this kind of things. So regarding that, I think there is a very basic model. Everybody in the world, they have own self as a positive minds, and they have the positive mindsets. So whatever we are doing as a Positive Plus Foundation, we just coordinated all these things. We're just making an integrated platform, and they spread positivity around the world. It's a very simple logic. And our movement is a positive virus movement. It's a global movement, and our 3 principles are there is a positive personality, positive thinking, and the positive action. So those people have the positive personality and mindset, those have the positive thinking, so they can easily able to do the positive actions. And that is really we have deployed in Bangladesh, and we are already crossing more than 10 plus countries around the world, and we have implemented a program in the Liberia. So our theme is very basic. This is a positive virus. Let the change begin with me. If I am personally is able to change, so I can definitely change the world. So that is basically the basic concepts, and we are aligned with the SDG. We are working on 3, 4, 5, 6, and 13 goals, and we are basically focused on the young generation, especially the school students, because they are the future. So we are not able to change the future, but we are definitely build the future. So that Positive Plus Foundation are working regarding that. Thank you so much.
Yeah, thank you so much. It's such a pleasure talking to such brilliant people here, full of positivity and energy. So, Dr. Hussain is always full of that energy, and everything around him brings that vibe to him. So, Dr. Al-Amin, you called it a positive virus. Why is the word virus used here? Because we are accustomed to using it in the negative connotations. So, why do you call it a virus? What is the science behind it? It's so interesting as well.
Yeah, because we all know about the positive is a negative term, and positive virus is always expand very quickly. As a medical doctors, you also know about the negativity, how the virus is providing the impact. Definitely, we all know about the medical professionals. But if we spread positivity just like a virus, that means it spread like a virus, but it shouldn't be the negative manner, it shouldn't be the positive manner. So when we are spread positivity just like a virus, that will great. It should be the contagious. Let's say if I have some positivity and I'm working with the people, and I give some kind of the example of my people, so they also be contagious and they can spread the positivity. So the virus, just like a virus, when virus is working like one person to the another person, multiplicate, replicate. So I wanted to make sure that our program, our movement should be replicated just like that, and that is the basically movement. It should be like growth exponentially, just like a virus. Yeah.
This is such an interesting concept, and it's such a Gen Z term to say things, because it adds such a vibe to the whole organization and whatever you're trying to do in the world. So I would like to now move towards Felton. Felton is a part of Positive Plus Foundation as well. Felton has partnered up with Positive Plus Foundation. Um, so, in itself, I would like to ask you, Felton, whatever you're doing with regards to INNOMBEL in Liberia, what was INNOMBEL actually about in Liberia? What made you start the organization, and what are you doing in terms of your vision with regards to your vision in education, health, and climate? What made you start an organization like that?
Thank you so much. It's a pleasure joining wonderful people like you on this live stream. Again, I'm Felton, Felton W4, and I'm in Liberia, a Liberian. Uh, Innobel, as you call it, as on the acronym, is fully called Innovation for Making a Better Liberia. All right. So we are in innovations to making a better Liberia. And so I personally have worked with a lot of international institutions, a lot of NGOs. I worked for NRC, I worked for IPA, I work, different USAID projects in Liberia. And so I have traveled all over my country. And what really moved me to have Innovates established in Liberia, Liberia has a civil crisis. A few years back, 2 decades now, and every infrastructure of Liberia is totally destroyed and nothing. When we returned, the whole country was lying in rain, and so that's where we started seeing a lot of international institutions coming in country, helping in different ways, and so after some time with my service with these institutions, I thought that there are some other things needed to be done that require some of us rising up and taking on the responsibility. Where you see young people after the war, too many mindset, too many negative mindset, and a lot of them are taking drugs, making wrong decisions, and all the future generation we see it gradually being perished. So we thought that, bringing innovations that will sway the mind of the young people in making sound decisions and how we can go in the slum and reaching them, I think is paramount depending on Liberians to get involved. And so that was the inspiration beyond innovation for making a better Liberia innovative.
Yeah, that's so inspiring, Felton. So, as regards to what Positive Plus Foundation is concerned, what did you find actually in Positive Plus Foundation that you wanted to work with them, or maybe found interesting in Positive Plus? What was that thing that you found that in them?
Quite interesting. With Positive Plus Foundation, with this project titled Positive Virus, and let the change begin with me. I think it was this name itself. It seemed to be one of the solutions that Innovative, must have longed for. We long for, such as innovation because, as I said earlier, many of our young people, in fact, many of them, even on school campuses, they have wrong friends, bad friends that they follow. And some of them, they are going on the contrary. And so looking at positive virus, I was trying to do a research to really understand what the virus, means and how do virus spread. And so you look at virus, the means of virus spreading for one is a very quick movement. But now we are seeing this virus is positive, and I have been longing to have these kinds of positive, ideas to impact into young Liberians so that they too now can be a sound decision maker tomorrow. So it seems like there's an alignment that I found with Positive Plus Foundation. Their goal of working with young people, students, molding their mind, giving them education, giving them leadership. It is something that we are already doing, and we having our arms open for a collaboration. I think we have the right people, the Positive Plus Foundation. They are the right partner for a Liberian students, and I think we are very lucky.
Yeah, that's great. So, as we all know that we have implemented one of our programs in Liberia as part of the Positive Plus Foundation. So, I would really like to know, Felton, from your heart-to-heart conversation, what was it that changed the lives of students, and what did you actually see that positivity in them after imparting that knowledge and that program in Liberia? Did you see anything? If that was, please share.
Definitely, even myself, I learned a lot during the process of the program. I saw a lot of things. How these these chemists now trying to make things different or changing the real field dirty water. I mean, making it useful. It was wonderful. But I think it was something that really inspired the students. It was a great motivation for them. Seeing themselves getting involved with this, uh, they were like, "How? Why will you talk about positive virus?" So some of them were skeptical. So I have to take my time to let them know you are going to be the positive virus, and then we need to have many of you after this training. So having them, seeing themselves getting involved, listening to these different lecturers, great people who kind of be really impact our young people. There was, I think, this is what we really need. But I think it's few. They was really, really happy. They learned a lot, too many things that they can now take back to the community, to their friends on campus. It is a great opportunity for them. They are very, very, happy, much by doing the process. Seriously. Yeah.
Yeah, I think this is the same virus of positivity Hussein always talks about. So I was a little hesitant when he shared with me this idea about the positive virus and everything. So I remember I made a chuckle that, Hussein, are you really sure? Are we going to do this? So then he told me, and it really resonated with me. So I really remember,
Right.
Felton, when we were discussing things, how will we initiate things in Liberia, what will be the logistical problems, and I'll still remember how we were having connectivity and internet issues at the time.
Right. Right.
So, but we
Right.
really made, yeah, but we really made it this far, and I'm really happy and really glad that this happened, and this will continue to happen. So I would over to I'll come back to Dr. Hussein Al Amin, but I have with a very brilliant guy, Dr. Sora David. He's from Uganda. I just can't help in introducing him first into our program today. Hello, David. Welcome to the show, and I would really love you if you can introduce yourself to the community, and what are you associated and why are you associated with Positive Plus, and what has your journey all been throughout. Thank you.
Yes, thank you so much, Dr. Maida. I'm very glad to join today to share with our community of positive virus all over the world. By the names of Dr. Soro David, and I'm the coordinator for Uganda. So I'm the team lead for the Positive Virus Initiative, something that spreads like wildfire. It started as an initiative in Bangladesh. It's now all over the world. So we aim to see that this positivity spread all over our African continent so that we change the lives of mostly our young people, give them optimism, make them optimistic, and mentor them, guide them to succeed in life. Thank you.
Yeah, thank you, David. We'll keep coming back to you, letting know from you the obstacles that you faced and the learnings that you had till now. But I will go towards Dr. Hassan again, and will ask him that what are the programs that he's working on, which I'm also a part of, but I would want him to tell everybody that what are the programs, what are the key areas which they've been working on so far. So over to you, Doctor.
Yeah, thank you so much, Dr. Maida. So basically, we are completely aligning with two things. One is the SDG goal, and second is the connection between the SDG goals with the positivity, and a special focus on the school students that I am mentioning earlier. That every school students around the world have the positivity, and SDG is around the world. So what's our goal is to fulfill and ultimately to make these things happen, that SDG goals has been ultimately fulfilled. So we are basically working on the 5 SDG goal: 3, 4, 5, 6, and 13. You all know about the good health and well-being. We have already doing a lot of this school health screening program in Bangladesh, and we have also planned to implement it in Africa and Pakistan as well. As Dr. Maida, you all know about that we have planned to skill health screening program around the world. Second thing is we have already developing a e-learning platform, but it is not still announced, but we are talking about as a p-learning platform. This is a positive learning platform, and it will be p-learning platform. Basically, in the p-learning platform is a positive learning platform, so where students basically getting all the knowledges via the e-learning, but they will definitely implement it to their community. So we are talking about the positive learning platform as well. And third thing is we are working on the gender and equality. We are working on the water and sanitations. We are working on the climate actions. And based on these kind of things, we are already launching a lot of the programs in Bangladesh, Nigeria, and recently we have launched a program in Liberia, and we are providing the e-learning education system to the 10 Liberian school students. We are taking classes on the hand washing, personal hygiene, community engagement, tree plantations, disaster management, and the students, they are really happy, really enthusiastic, and they are implementing whatever they have, getting the knowledges to their community, and ultimately they are providing the contagious informations to their community. So that I have talking you earlier, Dr. Maida, that we are planning initially, that is that everything will be work like a virus. So the basic theme is we wanted to do something for the community. We wanted to believe that definitely world will be mostly dependent on the young generation, especially the school students. So our main objective is to make some innovative mind around the world, and ultimately those are the global leader and those who will able to solve the problem. Maybe Positive Plus Foundation cannot solve the problem, but we are making a process. By using the process, definitely people can solve the problem by the contagious method globally. Over to Dr. Maya.
Yeah, this is something that Dr. Sen talks about in every meeting, that we cannot solve the problem. So it sometimes it feels a negative thing that we cannot solve the problem, but he always talks about whatever we do is a part of the process, and what the initiation of the process is important, then solving the problem.
Yeah.
This is the first thing that you have to do as a part of the community. So Dr. Hussain, what potential do you see in e-learning platforms to transform the community health programs in terms of whatever SDGs that we are working on? What is exactly the potential that you see in terms of e-learning platform
Yes.
that you were
Yeah.
talking about?
Yeah, definitely. And I basically talk my e-learning platform to be a p-learning platform that I talking earlier. So I am really preferable to convert it as a p-learning. That means a positive learning platform, because it's not completely a only e-learning. It will be both the e-learning and the one side, because it's a community engagement part. What the potentiality you look in the developing countries like ours, as well as other countries, a lot of the potential and brilliant people, brilliant students around the world, brilliant university students, brilliant college students, brilliant entrepreneur, they have the lot of the knowledges. And even though a lot of the villages, remote areas around the world, even though in the Liberia where Felton right now in live, the students maybe they are depriving a quality education. So what we can do, if we are using this platform and we are providing the free education, what I mentioned, we are not taking any kind of the charges, any kind of the free from the students. It's completely free. So education is completely free for us and free for the students as well. So when they just log in the system, they will get the platform. They will get a lot of the good, resources and access there, and globally that will be the global wing. So we have all the SDG themes and protocols there. So all the good leaders also there, good trainers also there. So from the remote area, our students can able to get the international level education and international level education knowledge. So that is used. So we cannot be able to make a barrier to build up community. So our developing plan of the pre-learning system is to establish a global education network systems where education is completely free, and every single, even though remote underprivileged students have a right to get the quality education services around the world. And here Dr. David also was the teacher of our students. Dr. Maida, you also teaches them. Myself also teaches a lot of the other my colleagues from Bangladesh, my a lot of the teachers, they also teach the students of the Liberia. So that is a process. So if we build up in the right direction, so definitely we can make a comprehensive global education system, and that will definitely changes the global ecosystems as well. Over to Maida.
That's great. That's great. I will go towards Dr. David. David, would you please enlighten us your experience with the health system in Uganda, and what potential do you see in Positive Plus Foundation as regards to what Positive Plus can contribute to the Ugandan community? What are the challenges? What are the grassroots problems? Do you see anything that the experience that we did with Liberia, that model, or do you think there are specific needs of the Ugandan community? Thank you.
Yes, thank you so much for that question. One, on the Liberian model, I really love it. It was a pilot project, so it was very successfully executed. Now we are looking at a way how we can replicate that model into our Ugandan system and targeting school children first. Then we can see if in future we can develop a global online program with a curriculum that can be given to several countries around the world. The potential of Positive Plus Foundation is more of like if we can empower young people to. Currently, the direction that our ministry is doing is to go after preventive health care, and hand washing, screening. These are all avenues that Positive Plus Foundation can leverage on to improve the health sector of our area and Uganda in particular. So if we can go strong, teach the young people healthy choices, healthy lifestyle, we think we can prevent the big burden of probably non-communicable diseases, infectious diseases. Currently, my country is kind of being rampant outbreaks of Ebola, Mpox. So these are all preventable infectious diseases. Through simple intervention, hand washing, we can really have a great impact on the community.
Yeah, education is an avenue which we can leverage on. Awareness is a big part of the process that we think. So we'll take experiences from Felton. Felton, if you can guide us, what were the challenges in implementing this program in Liberia, and how you were able to overcome those challenges as a part of Positive Plus Foundation?
Thank you. One thing that we struggled with to having the rest of the other students informed about after we have gone like 1 week, the whole school were kind of interested. They want to come, but we do not have such platform. So we needed to have a bigger space that can involve maybe about 20 or 25. So that's one thing that I can also reduce as a recommendations, and whoever will be moved, we want to support the process, and that is the heart of the Liberian. And another thing, the institution, the first thing, it was a voluntary work. The Positive Plot Foundations and INNOBEL voluntarily improvise to have this, education provided to the students. And so we receive all of the technical support, and then here we provide the platform. We have to be struggling with internet, even though when it's not there, we have to manage to have it on, and we need some a lot of logistics, probably a projector because we cannot do e-learning without projector and the laptops, something that would make the work very, efficient for the student to learn better, and clear platform that can be able to disseminate information across Liberia. So I think we come to a logistic problems and other materials that it was a personal challenge for me because I have to just to have this, achieve. I have to go on the extra mile to have it done. Some point, Dr. Hassan myself will go back and forth. I will play, say this one is it's heavy, so I cannot do it. So he will always be there, encouraging me. But then I think this is a program that needs the attentions of the world, molding the minds of the young people for better leadership for the future is paramount, and it is everybody business, and everyone should get involved in whatever way that this program will affect Liberia over, the country level, because we are divided. We are just in Monrovia, the capital city, just a little portion, just a one school. But the information has spread. Everyone want to come and get it. In fact, the school, the instructors, they want to be part of it. They need the education. They looking at the credentials. They come with, this is classical. But yet, their process to leading to the achieving that. So we can't go any better without any support. Yeah.
Yeah. This is so empowering and inspiring to listen to all of these things, and a lot of challenges that you told us. Even with those challenges, we were able to overcome some of them, and we were able to implement the program in a productive and positive way. So I would there's one thing that we always talk about, is that the power of the human capital, who, no matter how we are under resourced at this point, we always have the power of the human capital. Money is money, but people are people, and people are for people. This is one thing that we always talk about in every meeting, that we, as a part of Positive Plus Foundation, we believe in the human capital, which is undeniable, and with that power of positivity in you, you can even surpass the value of money. This is the power in humans. So over to Dr. Hussain again. I would like to ask you that whatever model that we have and we have implemented so far, do you see an element of sustainability in that, and how do we plan together to replicate this models to the other part of the world? We are centered around Africa mostly these days, but in other parts of the world, what potential do we see, and what are our future plans as part of Positive Plus?
Yes. So basically, the model that we are deployed in Bangladesh initially, then already it has been replicated in Liberia. We have planned to replicate it in Uganda, Pakistan, Indonesia, and Nigeria as well. The plan is very simple, that basically we need to connect the schools, and especially the school teachers as well, so that we have already working on. And once we are connected with the school teacher, first we have planned to registration of them to our p-learning system, that means the positive learning systems. And we basically give a lot of courses. Definitely that was the free courses as well for the teachers as well. And so once the teachers are motivated, then we will again go for some one side, just like the Liberia that we have go through, to connect with the students, not directly by us. The teachers will be working as a partner, as a moderator, maybe as an ambassador. So he will take care of maybe 10, 15, or 30 students in one batch. So we have a complete course curriculum and syllabus that is both into the the e-learning as well as the one side, as we are providing a lot of the instruction to the that school teachers as well, that Dr. David also mentioned. So can we do some kind of the standard curriculums around the world, because it may be vary from the country to the country, region to the regions as well. But what we wanted to do, it should be very specific, very professional, very understandable, and it should be the world class. That is our plan. So once it is happening, so we have planned at least in 2025 I wanted to reach around 20,000 school students around the world. And if you just calculate the number, if we would like to give an as a positive virus recognition to the 20,000 school students in the world, so that school students provide their contagious effect to the community. So you can just count, I wanted to reach around 2 lakhs people in the world in this year. I think this is very possible, because what you have mentioned, Dr. Maida, that human is human, and about money is nothing else. It's just a paper. Once human has wanted to use by himself or herself in a right place, that maybe has some the potential. But the main potential is in our mind, and that is the positivity. So if we are believing that it is really a sustainable and positive model, lot of the peoples around the world, lot of the organizations, they can able to help us as well, because this is a positive global movement, and we don't have any intention to get any money. We don't have any intention to give some business. So what we wanted to do, we just spread the positivity and make our world very sustainable and suitable. It hasn't be any border. Don't need any which country it is, which kind of the people it is, what kind of the population it will be covered. What we believe, the one things, all are the human, and all have a human mind, and all have a very positive mind. We just spread the positivity and convert the world from negative to the positive, and and ultimately it should be very good as well as to live. Over to Maida.
Yeah, thank you. So you mentioned organizations and people. So how can different organizations and individuals, if they're interested in what the work we are doing, they're listening to us right now, they want to be a part of this community, and they want to contribute in a meaningful way, what are the modalities they can associate or they can help with, and not just help but also contribute in a meaningful way?
Yes.
Can you please tell them?
Yeah, that I have already mentioned, that I don't want to those kind of the people who just come here, provide their name, and didn't have any contribution. So I don't need this kind of the people or organization don't have contribute. I like those people who have really positive and really positive mind, like Felton, like David, like Dr. Maida, because once the people is like to come, he can be work as a teacher, he can be work as a mentor, as maybe he can be as an instructor, he can be as our advisor, as our ambassador. But the basic things, they should be believe on the positivity, and they should have the positive personality, positive thinking, and positive actions. I don't need those kind of the people or organizations, those are only talking, no implementation. I love those kind of organization who have the implementation. So we have the website www.positiveplusweb.org. There is a form. Those who would like to interested to join with us, just fill up the form. Our HR and admin team will connect with you guys, and this is completely voluntary. So right now we didn't provide any kind of the money, because we are the voluntary organizations. We whatever we are dying right now in our own pocket, and this is basically for the human blessings. And this is completely the philanthropic work that we have done. But our vision is very sustainable, because if we do the good things, a lot of the people around the world who have the money, but they don't know how to spend the money to the good side. So if they would like to connect with us, we are cordially invited to join with us of our positive global movement. Over to Maida.
Yeah. So I think we are reaching towards the end of this discussion today. I think we can talk and talk because we love to talk, me and Alamin especially. So the time will go on. It's, I think, 35 minutes already. We'll go towards the closing, and I would really like to have David and Felton have their closing remarks for us and for the people who are listening. So Felton, please, the
All
closing
right, thank you.
remarks.
Thank you so much for providing this platform and to have our voice being heard. things that is happening in Liberia. I want to say thank you. I'm very happy about the collaboration, and I look forward to taking on another batch of students. In this way, we have our own pathways in the life of our young people who we are entrusting with our future leader. Thank you so much. Back to you.
Yeah. Thank you, Felton. Yes, Dr. David.
Yes, thank you so much. Actually, sharing such stories about different initiatives that we are doing in Bangladesh, Liberia, Pakistan, actually every time gives me energy to voluntarily bring as very many people into the foundation and the initiative. There are very many like-minded young people eager to change their communities, eager to change their world, but it's just a matter of identifying such people, and we shall have a ripple effect in their community with the very many work they are doing. So I'm very grateful for the initiative in Liberia. I think if we can replicate it probably within this month in another country like Uganda, we can bring in more countries by the end of the year. We shall really achieve more than the 20,000 target, Dr. Lamin. I believe by the end of this year, we shall reach as many young people as possible, because I've realized it has an impact, an initiative in one school. All the other schools that get to know about the program, they want to join in. Maybe we may not have the capacity to bring them in, but I believe with time we shall build the capacity, the technical abilities, and the resources. So thank you so much for everyone watching us. We are very grateful for you logging in and hearing it from us. We hope that next time you will share your stories of the different changes that we are doing in the world. Thank you.
Yeah, thank you. That's so enlightening and so refreshing to hear your perspective. Dr. Hussain, your closing remarks.
Yeah, thank you so much. So, what I would like to say, just a one sentence: everybody should have to be a positive virus, and let the change begin with me. That means start changes by yourself rather than suggestion other people to change. Let's change by yourself. Let's be positive. Let's changes your personality, your thinking, and your action. Convert the negativity to the positivity, and definitely, if you would like to change yourself, change the world as a continuous process. Over to Maida. And thank you so much, Mr. Felton and Dr. David, for joining the session. Thank you.
Thank you.
Thank you. Thank you.
Yeah. Thank you so much, everybody, for being here today. And whoever is listening from whatever part of the world, we welcome you to Positive Plus Foundation as a part of us. And Uganda, we are definitely coming next. Stay prepared. Thank you, everyone. You were listening to Dr. Maida Hussain from the platform of Positive Plus Foundation. I am based in Pakistan, and see you next time. Thank you, and bye bye.
Thank you. Thank
Bye
you.
bye.